I call the member for Dawson.
Thank you very much, Madam Deputy Speaker. In rising to address this fairer private health insurance incentives bill, I have some difficulty getting past the name of the bill itself, because it makes it sound like the bill will make things, as the title suggests, fairer. But this bill has nothing to do with fairness. In fact, it is the exact opposite of fairness. It's trying to justify the introduction of what is most certainly not fair. And I'm reminded of the late master of wit, Groucho Marx, who said, "The secret of life is honesty and fair dealing. If you can fake that, you've got it made." And that's a rather appropriate quote for this bill, I thought, because a bill is anything but honest, and it's trying to fake fairness. In reality, it's not about fairness at all. It's actually more in line with the views of the other Marx, Karl, and penalising the so-called rich. It is about a desperate bid to create a surplus, and it is about robbing the hard-working people of this nation who have actually created that, or who actually will do the work to create that surplus, if it ever happens. It's been 21 years since the Labor Party posted the surplus, and I've got to say it must be getting embarrassing for the government every year as they introduce new budgets, and we have the Treasurer here trying to say that he's going to get one next year. Well, because he will do anything to create the illusion of the surplus, just making it look like a surplus temporarily will do. But Australian families actually know what this government says is only good for a few months at best. But this time there's not enough smoke. There's not enough mirrors. So now we see the Treasurer hoping to pull a rabbit out of the hat, a $2.78 billion rabbit. They were running around, rifling through the files, looking up old copies of Hansard, scanning the demographic data, trying to find a sector of the community that's getting ahead, trying to find someone who hopes for a better future and is willing to work hard to achieve it. And that was their bunny. And they found it. A dead and twice buried plan to tax those people who work hard for a better life. They found yet another way that robs the rewards that are earned by someone else. So here we are today, once again, standing up to the Labor Party, the party of big tax. The title of this bill purports to be about a private health insurance incentive, and that word's important, incentive. The proposed legislation is actually not about incentive at all. There's no carrot here. This is a stick-and-stick approach. This government is pulling out the stick to those who pay for private health insurance. Anyone who has the gall to work hard and earn $80,000 or more a year will now have to pay more for their health insurance. Well, that's not an incentive. That's a disincentive. It's a disincentive to earn more, and it's a disincentive to purchase private health cover. Just in case this legislation means you can't afford to pay private health cover anymore, the government's got another stick waiting for you, a baseball bat, in fact, to slug more tax out of you in the form of the Medicare levy. So what we have here is a lose-lose situation. This plan was beaten down twice before, and there was so much opposition to that at that stage that even this government promised it wouldn't happen again. But yet here it is again before us today. Prior to the 2007 election, we had Labor's then Shadow Health Minister promising in a media statement dated 26th of September 2007 that federal Labor rejects the Liberal scare campaign around the private health insurance rebates. On many occasions for many months, she said, federal Labor has made it crystal clear that we are committed to retaining all of the existing private health rebates, including the 30% general rebate and the 35% and 40% rebates for older Australians. And that went on to say, and I quote again, the Liberals continue to try and scare people into thinking Labor will take away the rebates. This is absolutely untrue. If this was absolutely untrue, then why is Labor today got a bill in front of us that will do exactly that again? I thought that maybe there was a typo in the media release, and what the member for Gellibrand meant was that it was absolutely correct, but then she was backed up 2 months later by the then Prime Minister, perhaps future Prime Minister, Kevin Rudd, going on to the 2007 election with the promise. This is what the member for Griffith wrote to Dr Michael Armitage of the Australian Health Insurance Association just 4 days before the 2007 election. He said, "Both my Shadow Minister for Health, Nicola Roxon, and I have made clear on many occasions this year that federal Labor is committed to retaining the existing private health insurance rebates, including the 30% general rebate and the 35% and 40% rebates for older Australians. We even had the now Prime Minister, back when she was a Shadow Health Minister, saying this to Laurie Oakes, and I quote, "We will leave the 30% private health insurance rebate undisturbed because we understand it's factored into family incomes." Factored into family incomes. That's a very, very interesting observation there from the Prime Minister. But clearly the Australian Labor Party no longer understands Australian families or the fact that they have to factor these things into their household budgets. And so we're here debating a fairer private health insurance incentive bill. But what's fair about this scenario that I'm going to put to the House? Consider two young men. One, let's call him Bill. He lives and works in Melbourne and he earns $79,000 a year. The other one, we'll call him Ben. He lives and works in regional Australia, participating in the resource boom that currently underpins the economy. Now, Bill, a bloke in Melbourne, he lives a pretty comfortable life. He has no trade, no tertiary studies behind him. He spent long periods on unemployment benefits and he's currently got a 9-to-5 job that happens to pay a good income of $79,000. He rents a large furnished apartment in the CBD for about $450 a week. He doesn't need the car and he walks to MCG to watch his football team play or the cricket, and pretty good life. Now let's look at Ben, the bloke in country Queensland. He spent 3 years doing an apprenticeship and he supplemented his income to survive by working a casual job on nights and weekends. He's never missed a day of work and he currently works long hours to earn 80 grand. He has to maintain a work ute to get to job sites and carry his tools. He pays $550 a week in rent, and if he wants to go and watch the Bulldogs play football, he's up for about $600 in flights and $600 accommodation before a ball's even bounced. Well, groceries, fuel, even a cup of coffee in his area is much more expensive because there's a labour shortage in place and there's high freight costs that are pushing up the price of just about everything. So I'm sure that Ben can't wait for the carbon tax because he's going to be amongst the worst. He's going to cop the worst of the cost increases because he's in regional Queensland, and he won't be compensated in any way because his income's deemed too high. And you know, as a result, Bill puts his feet up in his Melbourne apartment, comfortable in the knowledge that even though he has a lower salary, he has a much higher disposable income compared to Ben. And under this fairer legislation, Ben will also be facing higher costs for private health insurance. He works harder and longer hours. He has less money to spend, but this government wants to tax him more, even though he already pays more tax than Bill. And how is that fair? And this is not an exaggerated case to make a point. This government wants to remove private health insurance incentives entirely from a family earning this year $249,000. They would have us believe that this family sits around just watching the big plasma TV, waiting for a $250,000 cheque to turn up in the mail or something like that. They'd have us believe that a family earning $249,000 or more a year are greedy rich people who should be robbed with an unfair tax. This family is not just a statistic. It's a family of real human beings with real jobs, with real children, with real experiences. Like a husband and wife who both work in the mines at Moranbah in your electorate of Capricornia, Madam Deputy Speaker, where they may live with 4 children. And to rent an average 4-bedroom home in Moranbah, they're going to be paying, as you well know, Madam Deputy Speaker, somewhere between $1,800 and $3,200 a week. And some rents are even higher than that. And so that translates to about $93,000 to $166,000 just for rent. Just for rent. And by the time you take out income tax and rent, our family that's on $249,000 a year out in Moranbah probably can't afford to eat, can't afford to feed the kids, let alone to pay fully for private health insurance. This government would have us believe that these people are evil people of privilege, you know, the old class warfare bogey. But this government does not see these people, does not even know these people because it stopped connecting with real people quite a long time ago. This government wants to smack such a family back down to the lowest level because they dared to have a dream. They wanted to get ahead. And I noticed an interesting headline in The Australian on Friday from a family talking about the costs that this piece of legislation will impose upon them. And the headline was a quote from Ms Kylie Richards of Adelaide, who with her husband owns a commercial flooring business, and she says it's ridiculous. The better we do, the more the government takes. Every time we try to get ahead and don't rely on a welfare system, we get a guarantee they'll hit us again. Well, Ms Richards has summed up beautifully this government's fallback position. None shall get ahead. I can imagine the Minister for Infrastructure and Transport doing a quote on Gandalf. They shall not pass, is what he's saying to Australian families. But what this government will do with this bill is to crucify both the economy and the health systems. According to this government, there are 2.4 million people living a life of privilege in this country, because that's how many people will be affected by this legislation. The result will be thousands, tens of thousands, I would say, of Australians who drop private health insurance because they simply cannot afford it anymore. And in my electorate of Dawson, there will be hundreds, if not thousands, of Dawson residents who will be worse off. Families that are already under pressure from the escalating costs of living, they'll have to make a saving somewhere else. The Minister has claimed that 27,000 individuals would drop their health insurance cover if this bill was passed. But the government-owned insurer Medibank Private suggests that figure's more, 37,000 in fact. 37,000 just of their members alone who will drop their cover, and a massive 92,500 people who will downgrade their private health cover. And that's just from Medibank Private, and what they see happening with just their own members. Taking an independent industry-wide approach, the Australian Health Insurance Association commissioned Deloitte to assess the impact of this proposal, and their findings were that, should this bill be passed, 1.6 million consumers would drop private health cover and a further 4.3 million would downgrade their cover. A further 2.8 million would drop their general cover. Deloitte also has predicted health insurance premiums would rise by about 10% over and above what they would otherwise be. So then everyone cops it because of this government's bill. As families and individuals leave private health in droves, the government will be rubbing its hands with glee. On the face of it, that will be a massive saving for this year's, fingers crossed guys, budget surplus. But enough of a saving it will be to create this illusion of a surplus, maybe. But the truth is that for every dollar the government spends on health insurance rebates, the private health insurers are spending $2 on the provision of health services. Those private health services will now have to be provided by the public system. And what this government is hoping to do is throw a hospital pass to the states for the sake of taxing Australian families and squeezing it out its first surplus in 22 years. Being a Queenslander, that's a frightening proposition. The Labor government in Queensland has plumbed the very depths of incompetence already without having to cope with more pressure on its health service. Private hospitals currently treat 40% of all patients in Australia, some 3.5 million patients in the 2009-2010 financial year. So how will the bungling Queensland health system, an organisation that the Premier tells us has failed under her watch, cope with their share of the increased workload? Private hospitals currently perform 64% of elective surgeries in Australia. Where will the funding come from for the public health system to cope with such an increased workload? In creating this damned if you do and damned if you don't situation for families that have private health cover, the government is basically kicking an own goal. If this white rabbit is combined with enough smoke and enough mirrors to create the illusion of a surplus, it's just a matter of time for the mirrors to crack and the smoke to clear, and when it does, Australian families who can no longer afford private health insurance will see nothing but a rotting rabbit carcass that carries the stench of deception, the stench of incompetence and the stench of betrayal.